First, welcome to our last session from Quantum, the patient and citizen community. And today we are talking about meet the facts behind the project. My name is Birgit Bauer. So the next slide, please. So please be aware, you have seen that this meeting will be recorded, and you can find the recording as always afterwards on our website. And please be aware, we do some photos during the session too, so give us a smile. My name is Birgit Bauer. I'm the task lead of Work Package 5.5 Patient and Citizen Community. I'm a digital health and data expert and also patient expert, the founder and CEO of the European Digital Health Academy. It's a non-for-profit based in Germany, and the coordinator of Data Saves Lives Germany. What we do today is, so we need the next slide. And I have to say, sorry, my voice sounds not as usual because I had during the last 2 weeks a big cold and it's still there. So it can be a little bit sniffy or a little bit coughy today. But I hope to get out of it during the next days. So our table of content, we had the welcome and introduction. We have also the introduction to the theme, meet the faces behind the project. We will also have, as always, a discussion with audiences and experts, and of course a wrap-up with some announcements and some summaries. The purpose of this session is to provide an overview about the faces behind the scenes of Quantum, or what or who are the team members. Learn more about the challenges and learnings, the different work packages, and something they had, I would say, some challenges, and learn about the work package teams experienced and what we will deliver in June. And of course, discuss and ask us if there is something what you want to know. But before the discussion will start, I have a question to our audience. Please let us know in the chat where you come from. Are you a patient or a patient representative from a patient organization, an expert, or do you come from academia, institution, governments, or something else? Please let us know in the chat to see who we have here in the run, and I will open my chat. So, okay. So while you are typing in where you come from, we have 3 speakers today. Mental health regulator. Okay. Hi, Laura. Our speakers today, we have Francisco Estupiñán-Romero. I hope I pronounced it right. Shortly, Paco. Paco is a data scientist for Health Services and Policy Research Group at the Institute for Health Sciences in Aragon, and he comes from Work Package 1 and 2. Then we have Carlos Telleria Orriols. He is a data scientist from the Institute of Aragones de Ciencias de la Salud, Work Package 3. And we have Maïté Vandevyvere. She's an e-learning implementer of the European Institute for Innovation through Health Data, IHD, coming from Work Package 4. So before we start to our speakers, I want to give you an overview about the focus on data quality and utility labeling and facts about the project. The challenges of Quantum were really, I would say it was really interesting because health data quality is a theme, the secondary use of health data is a theme, and to label it and to structure it, it was also a very interesting point. Different countries and health data actors in the EU collect and store health data in different ways. And we all know that, so because we have to work on the European health data space, so we have to come together in some way. And this makes it hard to create a uniform system that ensures all data are of high quality and meet the standard by the European health data space regulations. And the Quantum mission is to create a common label system that guarantees the quality and the utility of datasets for scientific and health innovation purposes. We have a big consortium by Quantum. So I need the next slide, Barthélemy. Thank you. And I'm having a lot of responses in the chat. Hello to Ireland, to Germany. And lots of people, thank you. Oh, hello, Frau Remmele. Okay, Quantum Consortiums. We have 5 partners from 15 countries, health data access bodies, data holders, and data users. There is also a big stakeholder community, Health Data at EU Forum, Projects Forum, and this is my area, Patients and Citizens Forum. And of course, there is an advisory board. We have different countries, Spain, Greece, Austria, Ireland, Belgium, Italy, Croatia, Norway, Finland, Portugal, France, Slovenia, the Netherlands, United Kingdom, and last but not least, where I'm coming from Germany. Our final delivery date is in June this year. Quantum builds on the TDOS, the joint venture project, now TDOS 2, for building the European health data space and the EHDS 2 pilot. And this is a conceptual building blocks towards the health data at EU at the TDOS, and the EHDS is TDOS concepts in real contexts. We have 7 work packages led by organizations coming from different countries. And while work package 1 to 4 are technical work packages, from 5 to 7 are horizontal work packages. So we have work package 1, specification of the data, quality and utility and maturity label. In 2, we have design, development, and the testing of the label. In 3, we have mid-scale implementation of the label. And in 4, and this is the last technical work package, is capacity building, community engagement, and scale up. In work package 5, we are taking care about dissemination and outreach. In 6, coordination, evaluation, and management. And in 7, last but not least, and most important, ethics requirements. So, and before we start into our discussion, we have a first Menti question to you, because we want to know, did you know about Quantum? Have you heard about us during the last 2 years? We started in 2024 and now we are coming to a final end. So we want to know, did you know or did you heard about us? Yes or no? Please take the QR code or use the code 13707152 or the link in the slide. Agatha, can you show us then the results? Thank you very much. But this is not the right question. So let me do it in that way. If please let us know in the chat.
I'm sorry. Sorry, I shared the wrong question. I'm so sorry.
I saw that. This is no problem. We can also do this in the chat. Let us know, did you know about Quantum? Yes or no. This is very easy and we find it out in the chat afterwards. I would say this is the very most easiest way to do it. We have people coming from Spain also here. Hello. And yes, they're coming, some yes, some no's, but mostly yes. So this is great to see. Okay. But telling me, can you bring us to the next slide, to the insights of Quantum, please? And to our audience, if you have any questions, if you have any ideas or thoughts to share, please let us know in the chat. Then we can also have a view on it and can move forward with your question, answer it in the discussion round. But let me start now with Francisco, Francisco/Paco, with representing work package 1 and 2 and sharing his insights. Paco, the stage is yours.
Yeah, thank you so much. Thank you for the opportunity to comment on this. As you may know, I'm here as a representative of, I'm part of the coordination team, and I'm here representing the Work Package 1 or Work Package 2. I think we can use the slides for support, Bartholomew, if you can. The point for Work Package 1, you will see in the next slide, is the specification of the data quality level. As Birgit commented before, the task was set in the requirement of Article 78 of the ADHD regulation. It was a clear requirement to have all the data sets that will be or potentially shared or available for the secondary use in the European health data space to be not just described in a systematic way, what are the contents, what is the coverage or the scope of the information or the data within the data set, but also to have them labeled in terms of the quality, the utility, and the maturity. And the first challenge we confront, if you can go to the next slide, is that we have to be sensible to the use case, the regulatory requirements are the agents implied in the use of the data to facilitate reuse. Because at the end of the value chain, what we have is that health data holds immense power for medical breakthroughs and to improve medical care, healthcare, or the health system as a whole. But the researchers struggle, or the population struggle to see the value of that data realized because they don't know where the data is, as it is fragmented. It's usually stored in silos under operational constraints. And it is difficult to see, even to have a clear view of what it is available. And on top of that, when you are initiating the process to access the data, you may not know what is the quality of the data. So you, as a researcher, as a data user, go through the process to access the data, complying with all the ethical and legal requirements at the end, have a data that cannot be used for your purpose. It's not fit for purpose, let's say. At the end of the day, that also entails a deficit in trust, because the system is more or less opaque, even when we are progressing to the European health data space. The progress to the European health data space, one of the progress is to set the governance around that data in order to clarify and structure the way to access and all the different requirements. So in order to see that progress realized, what we have to do is to inform users on the potential quality of the data sets that are going to be accessible or are available there. If you can go to the next slide. The realization of that is not just to set the specification or the definition of what is high quality in case of health data sets, but also what is the governance that produce that high quality data sets. So it's not just the fit for use, but the maturity of the organizations producing or stewarding the data, and the fit for purpose of the utility of that data. All that is specified in a standardized way and is materialized in the data quality and utility label, that if you want to think it as a metaphor, it might be as a nutrition label for each of the data sets. This has another additional complexity, is we are not thinking just on structured data. We are thinking in images and other non-structured data in which we have to agree what quality looks like. At the end of the day, what we want to have and what we have produced is a unique data quality, maturity, and utility label that will be used across all kind of data sets offered through the European health data space. So you have here some representation on how that might look like. The implementation of that will be done later by the Commission services. But all what we have produced is the schema that goes behind and the materialization of the label in a standardized way. If you go to the next slide, please. There are 4 distinct work areas to support this new labeling ecosystem. We are talking about potentially all the health data that is produced using public funding is susceptible to be accessible through the European health data space in the future for secondary use. Okay, and what we have to ensure is that the concept works, that the way we have specified the data quality for health data sets is aspirational in nature, in the sense that it puts forward a governance infrastructure that leads to a certain maturity level for the organizations, that ensures that the data they are sharing is of high quality, is correctly described and annotated. So that's the conceptualization part. We have to pilot our ideas and a schema and our implementation in real life with institutions that will be participating in the European health data space in order to check the feasibility and the actual reliability of the concepts and the governance we are proposing for the data quality level in real life. And then there is a work on the implementation side. So to just not produce a specification for the label, but also produce some supporting tools that will get you to the annotation, the quality annotation. And at the end of the day, the last part is disseminate the content and engage not just with the different stakeholders that will be using the data quality level, but also with the people that has the duty to implement it in the future in the European health data space. So if you go one more, please. Yeah, that will be all on my side. Thank you.
Okay, thank you very much, Paco, for this interesting informations. And now I make it very short now. I want to ask Carlos for his slides and for his speech. Carlos Telleria Orriols is data architect and researcher in the Institute for Health Sciences in Aragon and co-leader of Work Package 3 in Quantum. So, Carlos, the stage is yours.
Okay, thank you very much, Brigitte. I hope you can hear me well. Okay, if we can see the next slide, please. I will talk just about how we did implement the mid-scale pilot and some final suggestions about that. As Paco has explained, in Work Package 1, there was developed the conceptualization of the dimensions in the quantum model for about quality and maturity of the institutions and data sets. And in Work Package 2, there was developed a tool to assess the quality and maturity of the data sets. So our role in the project was mainly to implement and to test this tool and the understanding of the conceptualization of data quality and data maturity and utility in real life in some institutions. So we could finally engage more than 30 institutions across Europe including hospitals, data hubs, research institutes, health data infrastructures, and trying to get the wider variety in terms of data types and data and institutions and data models. So we get, as I said, from small to big institutions, even populational data sets. We get people that were working with tabular data. Most of them work with tabular data, but also with image, with genomic data, with different types of data models. So trying to get the most information about the piloting of the tool. We made 2 rounds in the pilot, just in the cycle about deploying, testing, evaluating, improving the tool, and deploy again and test again. So we got an extensive feedback from the implementers to get knowledge about what's the experience of the people about trying to assess their own data sets using the quantum tool. Next slide, please. Thank you. Okay. So in the during the execution of the pilot, all the testers use the quantum tool to assess one or even more data sets, and also to assess the maturity of their institutions. In some cases, to try to test the improvement in the tool. Some of the institutions test their data sets in the 2 rounds, and we also could compare the results between these 2 rounds. Some of the conclusions about the feedback we got from the testers was that the understandability of dimensions was not always easy, especially at the beginning of the pilot. All of them showed us that they need some training. That's been also developed in the Work Package 4 with the Quantum Academy, and also they ask for actual real life examples about how to interpret the dimensions, how to interpret the questions we offer in the tool, to answer and to try to adjust their own reality with the elements that were explained and conceptualized in the dimensions of quality and utility. One of the elements very important in this test is that the tool does not offer any automatic quality assessment. The tool does not enter or read the data in the data holder premises to assess directly the quality of these data sets. But the tool is configured as a self-assessment form. And this is for a good reason. We didn't want, and there are very different ways the data holders persist their information in different data models, in different tools, in different systems, and it's very difficult to enter in this data in a standardized tool to assess the data. But the most important for this is for this stage of the quantum project and the quality assessment in the context of the European health data space is that we actually need to enter all the institutions, all the data holders, all the hospitals and research institutions in the culture of quality of health data. And this is the reason, because we developed a self-assessment for what people should self-inspect in their processes, in the way they deal with the data, and try to answer if they are doing the best processes for managing data. Next slide, please. The importance of data quality in secondary use is very high. The problem when we are dealing with secondary use of health data is that it's secondary. We are getting data from the daily clinical practice, and we are reusing this data for different uses, for doing research, for doing innovation, for doing public health monitoring, for doing health technology assessment. And the data in the clinical practice is collected by humans to be interpreted by humans in a clear clinical context. And in secondary use, you are interpreting data in a very different way. So the quality of this data is very important in the primary use, but is also very important in the secondary use. And we need to have clean and valid data for doing research, for doing innovation, if we want that the results of this research or innovation is useful for the development, for the healthcare systems, and for the patients. Next slide. I'm getting to the key conclusions. It's very important that all data owners understand the data quality is essential for all the users, for users of data in the secondary use, so researchers, innovators, policymakers, to obtain useful results. And it's also very important for patients and citizens, therefore. And it's important to understand that quality, the quantum is not a quality certification test. Quantum is a tool to engage actors in the health data space in the culture of quality and continuous improvement of the data quality. Yeah. And the last slide, please. The higher quality a data set has, the more likely it's to be used, and the more valuable the results obtained will be. So it's important for data holders to guarantee the higher quality of their data, and it's very useful for them. It's very useful for data holders. It's very useful for data users, and it's very useful for patients. So maybe at some point we may consider a quality certification made by third parties, but it's necessary to advance in the culture of quality. That it's what we are doing right now with the quantum tool, with the conceptualization on quality and utility dimensions, and with the quantum academy. And the quality of a dataset is not only intrinsic; it depends a lot on the purpose for which you want to use this data. And this is, as Paco has explained at the end of his speech, this is one of the next steps in the quality assessment, that is to approach the fit for purpose. It's very important, not just to have an intrinsic data with quality, but also data whose quality is specific for a specific purpose. And thank you very much.
Thank you, Carlos. This was very interesting, especially also to give advice or maybe say, please, people outside, patients and citizens, have a look at it. It's important for us all. So thank you very much. And now to our last but not least speaker, Maïté Vandevyvere. She's an e-learning implementer at the European Institute for Innovation through Health Data. Maïté is representing Work Package 4. And also, I would say we will hear something what Carlos has mentioned already, the Academy. I'm looking forward to hearing your thoughts, Maïté. Thank you.
Thank you. Hello, everyone. My name is Maïté. I've been working for IHD for a little over a year now as their e-learning implementer. I have a background in healthcare, as I used to be a physiotherapist before making the transition to my current role. In my current position, I help develop the learning materials and also host and maintain our e-learning platform. I've been working for Quantum also about a year now, and I've been helping developing the learning materials and also enhancing the learning experience of these materials. As I've not been working for Quantum for very long, I want to manage expectations up front. So if there are any very detailed questions that I may not be able to answer, I'll excuse myself. But I'll try my very best, of course. You can go to the next slide, please. Okay, so let's talk about the role of Work Package 4 in Quantum. You can already go to the next slide, please. So the main focus of Work Package 4 was on people who interact with health data, so the data users, the data holders, and the health data access bodies. And the question was, what do they need as a training around data quality and data quality labeling? So Quantum carried out a survey, and one of the questions was how much they encounter data quality errors. And as you can see, almost 9 out of 10 people encountered these errors regularly, so that's quite a lot. And one of the most common problems were missing data, accuracy errors, duplicated records, inconsistencies across data sets. And these are not just technical issues. These are also, or these have an impact on research, on policy decisions, and of course, ultimately on patient care as well. So this brings us to the data labeling. You can go to the next slide, please. Okay, so the survey also asked about the perceived importance of data labeling, and almost 70% said that it was very important or essential to have such a label, so it shows strong support for such a label. The aim of it is to trust the data, to understand the data use, and also make better and more informed decisions, of course. Okay, you can go to the next slide. Okay, so after identifying these needs and the skill gaps, we try to develop learning materials that addresses these. So this is where the Quantum Academy comes into play. So all materials regarding data quality label have been centralized on the Quantum Academy, which is hosted on IHD's e-learning platform. And this content has not been made in isolation, so it went through a couple of rounds of validation, such as workshops and online surveys, to make the content very practical and relevant, of course. So this led us to the structure of 3 modules, and as you can see, there's a couple of courses for each module. And these are targeted at 3 different groups. So again, the data holders, the users, and the health data access bodies. Now, recognizing the different roles and different responsibilities of these groups, we have made a list of learning objectives for each of these modules. So each target group can go through the list and see whatever is relevant for their role. So we have made or tried to make the experience very user-centered. You can go to the next slide, please. Okay, so one of the biggest challenges we had was to make the content interactive and engaging, because these education materials can be quite complex, especially if you don't have the technical background. So we tried to focus on the learning experience, and we've come up with a structure where there is a variation of text, of videos, images. There are also a lot of quiz questions throughout the content. We've also added a resource library where we can add extra materials if people want to learn more about a certain subject. That's also possible. And we've added a course quiz at the end for each module, so people can test their knowledge and reinforce certain concepts. You can go through the next slide, please. I've added a couple of screenshots of what certain modules look like. So as you can see, it's a bit of text. There are images, there are quiz questions. So this was just to make the experience a bit nicer for everyone. Another aim for Work Package 4 was also to create a repository with resource materials that are not related or that are related to data quality, but not under the scope of Quantum. This is still under development because it's very difficult to create such a thing, especially with the focus on sustainability. So who will maintain this and develop this after the project ends? So this is still under development. Okay, you can go to the next slide. I do want to highlight certain challenges Quantum is facing, but not before I go over the achievements. So I think one of the most important things is that Quantum is a European project and one of the first where data quality is the main focus. So it gives the attention to data quality it deserves, which is a very major achievement. Also, it has highlighted the importance of a label. It has a lot of value, which is also very successful. However, I do want to go over the challenges. And one of the challenges are that I think Quantum is treating the label a bit as a standalone solution. But unfortunately, data quality does not end or start with a label. So as you can see, I've added an image where you see that data undergoes an entire process. So you have the data generation, data processing, data storage, and then you come to secondary use of data where the label and Quantum is situated. But as you can see, it's an entire process and not just the final checkpoint. So maybe Quantum is a bit at risk of oversimplifying a very complex process. And also the European Commission has intentionally focused on the label as an outcome, but also have maybe a bit too narrow perspective on what data quality is in practice. And external reviewers have also mentioned that the scope might be a bit too narrow to unlock the full potential of such a label. So I think it's important to highlight the successes, but also the challenges, especially with other data quality initiatives in the future, and especially with focus on long-term impact after projects end, for example. So that was it from my side. Thank you.
Thank you very much, Maïté. It's always interesting to see how a big project is growing, and on the other side, it's always important to see also what the challenges were or are still when we move forward, because I think also when this project will have an end in June, it will move forward in some way or in some different ways, let me say it in that way. So thank you to all our speakers for sharing these insights into the different work packages and also what Quantum has done during the last years and also what was built. So now I would like to open the discussion and shift the perspective for a moment. We have a Menti question for you. And we've now seen what Quantum is building or were building during the last months and years. Tools, labels, and infrastructure. But let's take a step back and look at this from your perspective outside. What do you currently lack most to be able to use health data in a meaningful way? A, clear and understandable explanations or informations. B, relevant to my own life. C, trust in how data is used. This is what we heard with Data Saves Lives Germany also, and with the European Digital Health Academy very often. Trust is a big question, not just in Germany, also across Europe, what we hear. Access to my own data is also mentioned by patients a lot, and support in everyday life means in tools, with tools, or with guidance. Please try to test out the Menti question. You can see the QR code, the link, and use the code 46802265. And now we have, yay, first results. As I said, trust. It's the most important thing at the moment, and we can see that. Also clear and understandable explanation and informations. Access to my own data. This is also something what we can hear in the patient communities. They want to access their data and want to share it by their own and make decision with it. And also support in everyday life tools or guidance, and access to my own data is growing. And this is really interesting because this is what I would say, struggling with also in the work package as a work package lead 5.5 here. Patients and citizen community is not so easy, and also to give them the understanding how it is used, and also to give them access to their own data is not an easy task. And I think it will keep us busy over the next years in general. But let's take us this back to our discussion now, because this was very interesting also to see how our audience is thinking. Also clear and understandable explanations and information is what we are doing with Data Saves Lives. We are building digital literacy in Germany and also on an international way. But let's come to our discussion. And maybe we can come back just to the slide, or we can interrupt also the slides for a while. Looking at your work packages, and let's take the results with us for the moment. Looking at your work packages, was there anything in your work that surprised or made you rethink in your initial assumptions? Maybe we start with Paco again, because you were the first
maybe
you had
I
time
start.
to a break.
Yeah, we had some experience in the use of data in our regular experience. My background is as a researcher, and we are in health services and policies. So we are used to the reuse of health data in order to inform policy decisions in health systems. So it was not that there wasn't anything that surprised me. It was more than when you enter to the specification, the level of detail you need, and to confront the different requirements for the different agents that are participating in the effort to build a European health data space. It would make it difficult, or would make it really complex. It's not just the idea that users need information on which data is available, at which is the level of quality they have, before entering an onerous process, a process that can be very heavy, complying with the ethical and legal requirements, and having the technological capacity to access that data in a way that can be leveraged to produce insights on any kind of decision, or even innovation to translate to the health systems. It's not just that, but you have to do it in a way that you promotes the correct governance of the data, promotes that as Maïté commented in the challenges, promotes the culture, the organizational culture, to improve the quality of the data over time, from the point of collection and regular use, so primary use, thinking in the secondary use, and to close that feedback loop that makes the health system a learning health system, so a health system that is intelligent enough that can inform on their own decision, on the past decisions. That is really complex, and that could be the surprise. It was not a surprise, but the complexity of the problems, it can take you aback if you are not prepared.
Okay, I would say Maïté or Carlos, who wants to come up first? What is your work that's about? What was your surprise, or the most big surprise in that?
Well, actually, I didn't got much surprise, but not talking about my own experience as data architect and responsible for one of the data infrastructures here in Aragon, but in my experience in the carrying out of the mid-scale pilot in Work Package 3, There was a big difference, and I think this is important, and it's one of the reasons for the development of the Work Package 4. There was a very great difference between those participants that have also been involved in Work Package 1 and have been discussing the dimensions of the quality and the maturity, and those that enter the project and start the pilot just in the Work Package 3 when they participate in the mid-scale pilot. Because the process of understanding the dimensions of understanding the different aspects in the quality of data and the maturity, and to get some insight about these dimensions in their daily work and processing is very important. That's the reason because why we have included in the also because it's in the specification in the European Health Data Space, but it's very important to link the data quality with the maturity of the organizations, and as the organizations have getting understanding of the processes of the data management processes and how they should deal with that, they understand or they get better quality for the data and better outcomes for what we ask to that data. So many of the participants that have not been involved in Work Package 1 or Work Package 2 and just get in the quantum tool and try to assess the quality of their data sets at the beginning, there was some disoriented about how they should, and they didn't understand the dimension that they asked for a lot of the real life examples and information. We offer this information. We offer real life examples, and step by step they were understanding that they were answering all the questions, and they at the end understood what we are trying from them to get information about their data sets, the quality of the data sets, and they began to understand the process of maturity in data management and what's the result of that. That's the quality of data.
Okay, Maïté, here you are.
Yes.
I think you got lost in some way.
Yes, my computer was fed up apparently, but I'm back.
Right.
Yes, just
I perfect timing.
Didn't hear what what the other said, but what I wanted to say was I think a big challenge for me as someone who didn't have a data background was first that data quality is very complex. So I was enthusiastic about the fact of having a label, and I see the value, but I do also see now that the value, like the label will not solve every problem data quality has. And what also surprised me was the fact that I think the needs of quantum are not always aligned with the needs of the ecosystem, I think, because if we look at the label, it asks for documentation about data quality dimensions. But I guess a lot of hospitals do wonder how to measure these dimensions, and also if they're not good, how can we improve them? So I think there's also a bit of a misalignment between both of those needs. But I guess the label is a good step in the right direction and challenging already certain data quality challenges, so, which is really good.
Yeah, that's very interesting. I have another question, because this was also one part of my work to explain to someone outside what is quantum and what are we doing this. So what have you guys done to explain it to people outside? So, okay, I'm doing a thing for secondary health, for the secondary use of health data, and it's called quantum. And we are doing a health data quality label. So how would you explain that?
If I may, the way I explain sometimes is most of the decisions we take in the health system in terms of planning, organization, administration of the health services, or how, for example, we extend coverage of the of the health services, or where to put the resources. Any question that you may have related to the a clinical question or an administrative question can be informed from data. It's not just an arbitrary decision from a decision maker. It can be supported by some sort of research project that produces insights on that decision, and that is made with data. If you have the possibility to access the data on the current workings and operational structure of your health services, that information will be relevant and will be would make sense within the context of the decision making. In order to do that, you have to have access, you have to have the data, though, you have to have access to the data, but not just all the data, but the relevant, the right data. And that's the point. It might be for a hospital, it might be the relevant data, the data from the patients, but the relevant data might be outside. For example, if you want to adopt a technology, a new technology that is being used in Germany, for example, and we want to adopt it in Spain, we have to have some sort of information how it had worked on Germany, on which population, in order for us to know if we can extrapolate and we can assume your results will be similar to us. Okay. So we may need even to access your data to test what you have to with that technology in order to support our decision, and that's the point. If from Spain, I don't know what data is available in Germany. I don't know what is the quality of that data, and I might need to access the data or to pull the information for all of Europe in order to make a decision. That's the point of quantum. That's the point of the European health data space, to make possible that kind of insight.
Okay.
Yeah.
So to share data and to have data available for possible research and development, etc., etc. Okay. Who else?
I think I don't have a data background, so I explain it even more simple, I think, sometimes. So when I explain it to friends and family, I say I compare it with a certain food label. So if you look at 2 bags of chips and I want to know which one I have to take, I look at the label it has and I can make an informed decision on which of chips I want to eat. So it's very simple, and I think maybe oversimplifying the process a bit, but I think that is what I compare it to, like a certain food label, but data scientists or engineers or researchers can make a decision between data sets based on the label.
That's interesting. I sometimes I'm doing the same, compare it with food and explain it with food. It's always a good thing, yeah. I would say. Also to our audience, if you want to have a last chance to ask a question, please let us know in the chat. But now, Carlos, what's your opinion? How do you explain it?
Just a comment about this, because this is the reason, because I will I'm talking continuously about maturity and the evolution, the continuous improvement. When we compare the label in quantum with, for example, the label in foods, there is a difference. If I have a company that make foods and I get a level of quality, I can sell more of my product. But in the case of data, we are not selling nothing. We're not selling the data. Okay. So what's the advantage of having a high quality score in my data? At the beginning, we will not have any high score I think in any data set in Europe. But if we are trying to compare the quality of our data with the quality of others' data, the difference is that if my data has good quality and I can prove the quality of my data, and I can prove the way I deal with my data to get the most of them, my patients, my people that I represent will be represented in the data set, in the projects, in the studies, in the analysis I am doing. And I think it's very important to have the most representation in people when we carry out any study and on any conclusions and any outcomes in health. So It's very important for me as data holder to have a good quality, not because I'm getting more money, but because my people, the people whose data I have in my repository is going to be represented in the study, and it's being part of the conclusion. It's important for me. It's important for the researchers. It's important for the patients whose data I have in my repository, and who are going to be represented in the study. And so the conclusions will be more valuable with better application to the healthcare with these patients.
Okay, thank you very much. Unfortunately, time's running out. So I would say it's picture time. And I know that our team member Barthélemy has his camera off. So please give us a smile, and let's do some pictures to make sure that we have some photos for our family album and for our closing event, what I will announce in a few seconds also to show.
Yes, no obligation, but let's put your camera on, those willing to, and I'll take a picture of everyone.
You got it?
Just one more.
Hey.
I think I got it. Thank you all.
Thank you. So now we have a slide for the final event. And I want to invite you all, so if you can bring it in, that would be great. On May 27th to May 28th, we have our Quantum final events in Brussels and online. So you see a QR code on the screen. If you want to be part of it, please register now and let us know that you will come to the event again. And I can promise, I had a first look into the program. It will be really interesting with lots of things, what we can show and what we will discuss. If you want to be part of our community, we have some options for you. You can visit our website www.quantumproject.eu. You can still subscribe for our newsletter or join our network. You have the QR code. Please use it and come to us if you want to know more. We are still here and we are still active, so everyone can give you answers or can provide you some informations. Last but not least, for me, it's time to say goodbye. It was my last online session for the patients and citizen community. During the last time, it was 5. You can see them on our website. Also, there are recordings available. And I want to thank you to all you who come to our sessions, and we all hope that you have enjoyed it. Thank you to all the network members, friends, supporters for your ongoing support and ideas. Thank you also to our community who gave us inspiration, but also insights in their thinkings. This was a great input and learning also for me, because I had lots of conversations about quantum during the last months, and it was interesting to listen and to learn also from the patients and citizens. And last but not least, thank you to the team behind the scenes, Barthélemy, Regina, Agatha, Celine, and all those who came in and left us already, unfortunately. But a big thank you from my side also to make this series possible and giving knowledge and information about a theme what is not always possible or easy to understand for patients and citizens. We have the photo, we have this last session, we are coming to an end. Thank you to all our speakers today. Thank you for all people in the audience. Thank you for being here. And if you want to have some more information, I gave you the options. So contact us, talk to us, and be with us. thank you for now. I wish you a great afternoon today and a good time, and I hope to see you soon on somewhere. And finally went register. Thank you very much and goodbye.
Thank you for all, Birgit.
Thank you.
Bye bye. Thank you very much.
Bye.
Bye bye.
Bye.
Good afternoon, everyone.